UTI, very common in pregnancy, and then it makes the the hormones also does also affect the whole process, such that um, the those tracts that should contract and prevent infection, they are relaxed. All right, and so it makes it easy for bacteria to to come in. So next is, what are the signs and symptoms of UTI? How do I know that I have UTI? Oh, doctor, you are talking about infection of the urinary tract, but am I sure I've had it before? I don't know. What what are the signs and symptoms of urinary tract? So the following are the signs and symptoms. The first one you notice are the what we call the urinary symptoms. Pain during urination, burning sensation. You only have it when you want to urinate. As the urine is coming out, you're just feeling burning sensation. Particularly when it's the last one that comes out. Or you are passing urine very frequently. At night you can wake up 7 times, 10 times to pass urine. In fact, you notice that your sleep is disturbed because of urination. You go to pass urine, you've slept, it's not up to 20 minutes again. You are feeling the urge to pass urine. All right? And then when you go and pass urine, you feel as if you have not emptied everything. Like I said before, when the urine is coming out, you are feeling that burning sensation. These are all symptoms or signs of urinary tract infection. All right? And then there's also that hesitancy. You feel like passing urine, but when you go, the urine is not coming out. It's shy. You'll stay there and be trying before something will now drop. Okay? And of course, if it becomes really, for some women may have fever. All right? Some women may have fever. All right? Some women may feel nauseous. All right? Some women may have cramps. All right? Next slide. May have cramps or pain. All right? In the lower uterine, in their abdomen. Then some women may have pain during intercourse. All right? May have pain during intercourse. These are all signs and symptoms of urinary tract infection. Like I said before, you may have fever, chills, you are feeling cold, you're sweaty. All right? And some women may suddenly be unable to hold their urine. Once they feel pressed, before they even go to toilet, the urine is already escaping. All right? So I've mentioned the fact that you have to go several times to pass urine at night and even during the day. Now, once you begin to have very high fever, you are feeling a lot of chills, okay, nausea and vomiting, most likely that infection has ascended into your kidney. If it's just cystitis, that is infection that is just within the bladder alone, you will not have all of those generalized symptoms like fever, chills, nausea, vomiting, pains on your side. You won't have it. What you may feel is just that you're feeling that you are passing urine frequently. When you pass urine, you feel pain, and then there's this burning sensation on your lower tummy below your umbilicus. It means that most likely you're having cystitis, that is infection within the bladder. Once you start having those generalized symptoms, it means that that infection is not just within the bladder, it has ascended into the kidney, and that definitely requires treatment. And for that, you may need to be admitted into the hospital and treated. All right. So the next is, how will UTI affect my baby? How does UTI, how does urinary tract infection affect my baby? Okay, so we have said that when the patient has urinary tract infection, One of the things that happens is that you start having abdominal pains. Start having abdominal pains. All right? You start having abdominal pains. If it affects the kidneys, you start having very high fever. All right? Those pains and the fever can cause your uterus to contract. Once the uterus starts contracting and you're pregnant and you don't treat it, what will happen? You stand the risk of having premature labor and premature delivery. Once you deliver early, because the baby will be low weight, baby will be premature, and all the problems of prematurity would come depending on when this happens. And also, patients who have urinary tract infection can also become anemic, all right, particularly if it's prolonged, chronic UTI infection. So that is how it affects it affects your baby, and that is why during your antenatal we try to make sure we detect early signs and symptoms of UTI. That is why any woman that comes to antenatal at this center, one of the things you must do is what? A urine test, urinalysis. Very important. That test is so important that if you come to the hospital 5 times, you do that urinalysis 5 times, an opportunity. Because that urinalysis can help us detect if you're having UTI but it's not manifesting. There's what we call asymptomatic bacteria, meaning that your urine has bacteria, but your body is not manifesting it. Why? Because your soldiers are still very active. You know, some people's soldiers are more militant than others. While some people have the defense force is soldiers, others is police, others is civil defense. The one that is civil defense, small thing they have wiped them away. But the one that is military, ah, those ones that are still standing. It takes a lot. All right. So when there are some patients you will see when you do their test, you are seeing a lot of leukocytes. You are seeing nitrites, proteins. All of those suggest that this woman may be having a bacterial infection in the bladder, a UTI. If you ask her, are you passing urine very frequently? Say no. Do you have pain when you pass urine? No. Am I supposed to have pain? No. But how come when you check the urine, there's nitrites, there's a lot of leukocytes? It only means that yes, it is present, but the body is not manifesting it because the body is trying to overcome it. But having said that, let me balance it. Some patients may have frequency. They may pass urine frequently, but it doesn't mean they have infection. Particularly those ones who like to take water a lot. Water is good, by the way. I encourage all of you to take water. Now, where is your water bottle? How many of you came with your water bottle or source of water? Let me see it. I want to see. Correct. Aha, correct. Good, good. Those that did not come, know that you must always be accompanied. Your bag. One of the important things that must be there once you are pregnant is water. Taking water regularly is very good. As you will come to understand when we start talking about the treatment for UTI, that taking a lot of water helps. All right. So next, so how do I know if I have UTI? So like we said before, some people may not even know they have UTI particularly those who are asymptomatic. And that is why you do antenatal when you are pregnant. And when you come for your antenatal, they will run tests for you, do analysis that checks your protein, nitrites, and that will tell you if there's UTI or not. Next, number two is the symptoms. When you have UTI, a lot of patients will have symptoms that we'll talk about. You have frequency, that means you're passing urine very frequently, that disturbs your sleep, or during the day you can hardly stay without going to the toilet. You always go to the toilet to pee, and we've tried to describe how the the characteristics of the peeing. You pee frequently, sometimes not much. When you finish peeing, it's as if something is still left. You've not emptied everything. And when you get there, you find it difficult to start. All right. And then when the pee is coming, you are feeling pain, burning sensation. So all of these are all symptoms that suggest that you have a UTI. And once you have any of these symptoms, your doctor must be aware. You must come to the hospital so that you'll be evaluated, you'll run tests, all right? And what are the tests you do? First of all, you do the urinalysis, which is very quick, and it's for every patient that comes who is pregnant. Then after you have done that, you also now do a urine culture. What is the essence of that culture? That called urine microscopy culture and sensitivity. Three in one test. The microscopy is to find out, are there any bacteria? So the microbiologists will be looking under the microscope to see if there are any bacteria that can be seen. If they don't see any, they will culture it, put it under a special condition and media for see if anything will grow, and then they will culture and see if there will be any bacteria that will be found. And then they will not do sensitivity to antibiotics because you don't want to just give antibiotics. You want to know what is the specific bacteria that is causing this infection so that and what is the antibiotics that is sensitive to that bacteria that will handle that bacteria. So once you do that, within 48 to 72 hours, the result is out, and then you're able to give, you're able to treat appropriately. So how do you treat UTI? You give antibiotics, safe antibiotics. And I know that women are very, um, not women, generally we are very cautious about giving medications in pregnancy. But there are safe medications that you can give. So that is why it's not on self-medication. You must meet your doctor who will prescribe a safe antibiotic for you to take. All right. And with a 3 to 7 days course of antibiotics, you would be taken care of. Like I said before, if you're having other symptoms like fever, chills, nausea, vomiting, contractions, that most likely may require admission because sometimes the urinary tract infection may have affected your kidneys, in which case you're having what we call pyelonephritis, that's inflammation of your kidneys, that will require you to be on IV antibiotics for some days, all right, and then be on intravenous infusion to ensure that you're taking enough fluid, all right. While treating UTI or to prevent UTI, you must ensure you are taking enough fluid. So all those are wonderful patients who say, "Oh, doctor, taking water is a lot of struggle." Ah, you must try. Any which way, you must try and take water, whether it is pure water or water added with some minerals or whatever to change the taste. Just make sure you are hydrated. You are taking a lot of water. All right. So once you're taking a lot of water, it helps to clear your urinary system because you notice the more water you take, the more you pass urine. So if there is a colonization of your bladder with organisms. All right. By the time you start taking lots of water, it keeps flushing it away. That's why sometimes some people may even notice that even without taking any antibiotics, just by taking water therapy, it sometimes helps and reduces those symptoms that you have. All right. But that is why the first thing is that water is required. And when you are when you are pregnant, you also need to realize that I'm talking about the need for you to take water. Your your vessels, they go through what we call dilatation. Your blood pulls into your intravascular space, so that the blood that is now that goes into your organs sometimes can be reduced. So because of this, you need to take a lot of water to remain hydrated. Do you understand? So that you are able to prevent some of these conditions. And then the other things there that we have put there, put to eliminate caffeine. Nobody takes caffeine now. Hope you all know that when you are pregnant, you don't take caffeine. Whether it is in coffee, whether it is in smoke, you don't take caffeine. Now, if you know that you don't take alcohol, not even in a very small. I say, doctor, even small, just small like this. No alcohol. Why? Because small like this can become big like this. You say, no, I just wanted to you say, just to gauge it. No, no alcohol while you are pregnant. So that you don't have a baby that become alcoholic for this time. So no alcohol. Hmm? And then you can do vitamins, vitamin C, beta carotene. All of these things, they all help to fight infection. They're all more like natural remedies that you can use. And then some of the other preventive measures is to develop the habit of urinating as soon as you are pressed. I've mentioned this before. Don't form the habit of keeping urine. You know that some women who the only place they can urinate is their home. Ah, so once they go out and they are pressed, nothing, they will hold that urine. Nothing will happen. Why? Because they are so scared of contacting infection anywhere. Once they use somebody's toilet that is not their own, infection has come. I know that sometimes this thing is psychological. It's psychological. And they'll begin to manifest it. What happened? Right from when they use and they come out, first of all, they just start itching. What happened? It is that toilet I used. No matter how clean the toilet is, uh, once they use a toilet outside their home, wahala. And what happens is that you go out, you are pressed, and you have a lot of things to do. So you don't get home on time. So you will keep that urine for hours. Then, so it's not good. So if you know you cannot use any toilet outside your home, then make your journey sharp, sharp. Before you leave the house, empty your bladder. All right? So that when you go out, and when you are out, don't take a lot of water. But when you take a lot of water, you will feel pressed. Okay? Then urinate before and after intercourse. Very important. And then when you are cleaning, after urination, women they clean up. You just dab, don't rub. You understand? And we have tried to explain before, and I want to believe that all women they know this. You don't wipe from back forward. You wipe from forward backwards. But if you wipe from back forward, you are introducing organisms from the anus all the way up into your urethra. Okay? And then avoid the use of soap Like I said, if you want to wash water, don't add anything to it. Don't even add Dettol. Say, doctor, no, nah. I want to kill all those things that are there. Like I said before, there are good bacteria and there are bad bacteria in that area. When you want to kill and you use those disinfectants and all of those things, you kill both the good and the bad. And the bad is the one that will not grow fast and take over the place. All right? Lactobacillus is a good bacteria that creates a hostile environment for the other bad bacteria to grow. If you um, carry out all of these harmful practices, what happens is that it changes the balance of the bacteria that you have there and allows the undesirable bacteria to grow. All right? So water is enough. And of course, make sure you practice good hygiene, change your linings and panties regularly. Make sure the place is dry. And with that, you will be able to prevent UTI. All right? So that is urinary tract infection. So we'll take one more before we take questions and then we're done for today. The second is common medical condition that happens in pregnancy is what we call hyperemesis. What? I want you to pronounce this. Correct. Hyperemesis gravidarum. What does it mean? Vomiting. In pregnancy, women vomit, right? Vomiting means emesis. The women vomit. Some women vomit, some don't, they don't vomit. So if you are here and you did not vomit, no problem. Some will say, doctor, I hear that when women get pregnant, they just vomit everywhere. They spit everywhere. But nothing, no. It happened to me. Are you sure I'm normal? You are very normal. Do you want to be vomiting everywhere? No. Hey, so why are you? Now, every pregnancy is different. So nausea and vomiting is one of the common symptoms of pregnancy. So if it's common, we will not talk about it. But the reason why we're talking about hyper, because this one is the senior brother and grandfather of emesis gravidarum. Excessive vomiting. The kind of vomiting that you vomit that nothing retains in your stomach. Anything you take, even water, you throw out. And when that kind of condition becomes prevalent, it can seriously affect you. And once you pick it up, or once you start having excessive vomiting and you cannot tolerate anything, then you need to come to the hospital. You need to be admitted. You need to be rehydrated and to stop the vomiting and break the cycle. All right? Fortunately, it doesn't happen to a lot of women. About 1% of women who are pregnant will experience hyperemesis gravidarum. So let's take a very quick poll. Having explained what hyperemesis is, stop your hand. Only one person. That tells you that it's not a common thing, but it's just that you know what it is. And so once you have it, once you start vomiting excessively, you're not tolerating anything. Like I said before, you may need to come in for admission. But why do women, before we go on to distinguish between the normal morning sickness and the excessive hyperemesis gravidarum, but why do women have this condition? Some women may have it because that is probably their first pregnancy. So their body is not used to ACG at all. What is this thing? Why is my body like this? So they are reacting. All right. Number two, women may have it because they are carrying more than one. So if you're carrying one and you have a mesis, if you carry two, what will you have? hyper. If you carry three, what will you have? So that is how the problem increases. So multiple pregnancy give that condition. So once you see a woman who is having excessive vomiting, more likely than not, it's either maybe it's her first pregnancy or she's carrying multiple pregnancies. Or some that is just the way they are. There are some people that they are carrying just one. It happened in their first, it's happening in their second. Their body is just like that. They're not able to tolerate the HCG that is produced. All right, so they react excessively. So, like we said, we try to put the differences between morning sickness and hyperemesis so that you don't go and start vomit only once in the morning and say, ah, honey, like I have hyperemesis. No, no, no. There's a difference. So you see, for morning sickness, you have nausea, sometimes accompanied by vomiting, but in hyperemesis, you feel nauseous and accompanied by severe vomiting. Like I said before, you're not able to tolerate anything at all. All right. Nausea normally will subside after 12 weeks or soon after if it's hyperemesis, except you are kept, does not abate. And then for the vomiting for emesis, there's no dehydration because you vomit just in the mornings and then you're able to tolerate water, you eat, so you don't get dehydrated. In hyperemesis, you get dehydrated. There's severe dehydration. Why? Because you're not tolerating anything at all. Nothing goes, anything that goes in comes out, except you use medication to break that cycle. Okay? So like we said, emesis, morning sickness allows you to keep food down. Why? Hyperemesis, you cannot tolerate anything. So what are the signs and symptoms of hyperemesis? Abidarum. So we said there's severe nausea and vomiting. You start running from food. Once you see food, your mood will just change. Just be trouble. Ah, so they run away from food. Anything has to do with food, and not just any food. Not just no. Some will say, ah, no, this one I can still tolerate this one. So some people may end up eating indomie all through. This is gravidarum. Everything. All right. So you have that is why some women, when in their first trimester, they have this. By the time they get into the certain amount of weight, and they will now start trying to gain that weight in the second trimester. So by the time they get to the third trimester, when you are checking their weight, they will tell you that, doctor, nurse, I'm not adding weight. You're adding weight. What happened was that you lost weight in the first trimester, and now you are gaining weight because in that first trimester you're not eating. But if you don't eat, you don't drink. The baby then was even small, so baby was not contributing anything to your weight. So you will lose weight. In the second trimester, when the symptoms have subsided and now you're not able to tolerate food, you're not eating. Now you first of all need to gain the weight you lost before you now start adding weight beyond what it were before you got pregnant. You can't take any water in, you will not pass urine. And those who pass urine, you notice that the urine is very concentrated. Coca-Cola. That is very severe, extreme stage where I'm fainting. That's why a woman who is not able to tolerate anything and is not getting food and does not come for admission to have IV infusion, after a while, that woman will start fainting. Your blood pressure will be low. You have confusion, get confused, headaches. All right? And so any woman who starts feeling like that, you must get in touch with your hospital and come in so that you will be treated. So what are the treatments for hyperemesis gravidarum? So the first thing is that you need to be admitted. Hospitalization is required, and then you need to set up an infusion line, an infusion, and give you infusion to restore hydration. And then, of course, when you are vomiting, you're also losing what we call electrolytes. It's not just clear fluid that you are losing. So sodium, potassium, chloride, they are all lost when you are vomiting. So we need to restore all of that. Okay. So they will add some multivitamins to the drip that you are taking, then give you something to stop the vomiting, medications, antihistamines, metoclopramide, all of those things are very good, safe medication that can be given to stop the vomiting, get you hydrated, and once you begin to eat, and then you can now be allowed to go home, to rest, and then you continue. If it comes again, then we'll repeat the same thing. Some women may have pregnancy, some may have it twice, some may become regular visitors to the hospital, particularly in that first trimester. For some, it may even continue to second trimester. While other people are saying, hooray, thank God I'm free, some will still say, when will this end? So pregnancy varies from one individual to the other. So bed rest, and then you have some herbs like ginger will help. All right. So tips on how to reduce nausea in pregnancy. So nausea is a very, very, very common um, symptom that patients have when when they are pregnant, particularly in the first trimester. So some of the things that have been highlighted that you should do when to help to reduce nausea is what has been written. You take your time getting out of bed. For the pregnant woman, everything you do must be intentional. You don't just do as if no, 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 no. You must go through a protocol, a process. So don't allow your husband to rush you and say, why are you? Uh-uh. Say, come on, I'm pregnant. Remind them, come on, they take their time, all right? And then to prevent this, you serve them on the bed, breakfast early. Oh, yes. The men in the house and those listening, you serve your wife where? On the bed. She wakes up, she sits down, doesn't get up, all right? And then you serve her. The men are saying, doctor, doctor, hey, doctor, this thing you are saying, be careful, oh. Ah, all right? So, say your partner to bring you food to you or prepare snack. Hmm? Prepare and bring it to you. And then when you eat early, just take something light. It helps to reduce the nausea. When you become very hungry, the nausea increases. So you don't get to the point where you become hungry. So even if you're not feeling like, just take something. And what we encourage throughout the day is that just be eating small, small, small. You can eat like 10 times a day, 12 times, but small, small. Just be small, small, small. Madam, don't worry, Oga he has the money. Exactly, eat it. Mhm. Just be eating. But say, is everything you are eating? What did you? Oga, relax, calm down. Your wife is what? Pregnant. Okay? So when you eat little, little, little like that, it helps to prevent the, the nausea. All right? And then again, we say take a lot of fluid, very important. Always make sure that you are well hydrated. Fruit juice, herbal tea. Avoid food that contains fat, all those fatty things, fried things. You know, avoid them. Vegetables are very good. Fruits are very good. All right. Then rest. Rest a lot. Hmm? Just enjoy the experience. Move slowly and avoid sudden movements. All right. Just like I said, be intentional. Then try and avoid smell. that makes you feel sick. If your husband's perfume is the trouble, then ban him from using perfume. Or if he must use perfume, let him use it outside. You put perfume in his car. So when he's going out, he will put it. Then when he comes back, before he comes to hug you or come to a room, you should change. You should go to one room, create one small room, and change and put those clothes, and then before he comes. Because a woman will be fine, and then suddenly the man appears and the woman just changes. Ah, what happened? You are the one. What did I do? I don't know. But as you came, my system changed. It's because of the perfumes and the smell. All right? And then, again, when you brush, also matters. Don't go and brush immediately after you have eaten. You likely throw up. Okay? So, you brush, wait for some time, after which you brush. Then, make sure you have a lot of air. That helps. If you are in a stuffy environment, then that could also create that place where you become very nauseous, where you feel sick. That's why you need a lot of light, you need a lot of air, all right? So that fresh air does a lot of good. Make sure you keep your windows open, all right? But some people, they love cold environments. So for those ones, put on the AC, stay inside the cold environment. Some people, they hate cold environments, so you don't put on AC. Everybody can be hot and frying, but for you, nobody can touch that AC. So, and when a woman is pregnant, she's priority. Husband is secondary. Every other person is in charge. So she dictates and determines the environment and what happens. After all, not forever. This is 9 months. After 9 months, things will change. So, husbands, just bear. Okay? Men in the house, I know I have your support. Correct. Okay? Then, of course, you exercise is good. You exercise, go for little walks, all right? Avoid alcohol, avoid caffeine. Say, doctor, can't do without my money too. Mm, that is where the problem is. Yes, you can have tea, but you know there are some teas that are decaffeinated. So what is important is that caffeine, whether it's in tea or it's coffee, it's not good. So if you must take tea, you can do some herbal teas. You can do some teas that don't have like deadly teas. There are some teas that don't have caffeine. So you can do that, and that will be fine. All right. So at night, like I said, before you go to bed, make sure you take a snack. Don't go to bed on an empty stomach. And then, hmm? Okay, said diminish your appetite. Yes, yes. Can you imagine the woman is pregnant, morning to start with alcohol instead of food. There's wahala now. So all you are taking is just tea, tea, tea. There's wahala. So all of this is better to avoid them. Okay? So all that we've discussed, these are not foolproof, but at least they will help to reduce nausea and vomiting and ensure that you go through the pregnancy process that will be as less stressful as possible. Thank you very much. Okay, so time for questions. Any question? Yes. Gravidarum. Mhm. Yes. But but are you having those other symptoms of are you vomiting excessively? Okay, that one is not due. The confusion here we're talking about is as a result of severe dehydration. Ehen. The other one that you're talking about, psychological conditions, is also something that is common in pregnancy, where you you go through some psychological issues where you feel it can be from anxiety all the way to depression, where you're having mood swings, mood changes, little things make you cry, you just get angry unnecessarily, you're just agitated, you're losing it, you're not able to coordinate. Hormones does a lot to women when they are pregnant, and different women react differently. And it also depends on your social network, your environment at the time, and what you are dealing with. There are people who have a lot of strong support during the process of pregnancy. Their husbands are very supportive, very caring, over caring, TLC, for instance. But there are some women who are going through this and they feel as if they are all alone. They are, they are receiving a lot of pressure here and there. It's difficult for women at that stage to be able to coordinate and handle situations. Then on top of that, you now have some very terrible things happening during that process when you are pregnant. All right. So yes, it's something that can happen. If you're somehow feeling overwhelmed, then you need to talk to your doctor. Yes, you can also provide some psychological support in terms of therapy, just to ensure that you go through successfully. And this is very important because when you deliver, if your psychological state is not healthy, then that is where some women get into, and it continues. Some women get into puerperal psychosis. Let me put it, puerperal madness. That is madness after delivery, where you don't want to see the baby. Where if the baby is given to you, you can even harm the baby. You understand? And all of these things are things that occur because of the fact that their psychological state was not handled, was not stable enough. It continued after the delivery process, and then they just lost it. So that's why when you're managing a woman, you also have to manage her psychological state also, knowing that these hormones also can affect our psychological state. Some women are tough, so that's why every woman is different. So that's why no man, and please, men in the house and those watching, don't compare your wife with anybody. Uh-uh. Is it not this pregnancy you are just doing like this? You know how many children my mother delivered and carried? But no, she didn't even do her antenatal. She even delivered in the farm, carrying firewood. And you very small thing, you just say, my back, hey, calm down. Please, all women are not the same. Pregnancy makes the woman a fourth being. They're different. And every woman is different. All right? And so they should be treated with a lot of care, making sure that we attend to their needs as it arises. Okay? Any question? Yes? Talk to that baby. What is it? Once your master, we start telling you you can either lie on your left or on your right, depending on the one that is convenient for you. And those positions, yes, even when you lie on the on your tummy like this, with your big tummy, it's you that will feel the discomfort, not the baby. Remember, the baby has layers of that covers the baby, and there's the membrane that has water. It's just like you are saying somebody is outside and you see a container, and it's inside. I don't know why the baby will not be moving excessively once